Hi, my name is Rachel Tay, and I'm going to apply for both the Vietnam and Timor Leste overseas placement. So this will be a great learning opportunity for me as a professional, as I'll be able to develop practical skills that cannot be taught in lectures and tutorials at university. And all these skills will be applicable to my future clinical practice as a occupational therapist. So by going overseas, I will be working with different organizations that may have some different ways and different approach, different culture to doing things as well. So this will help me to be flexible as a client in the future, as different organizations that I work with will definitely have different ways of doing things. So having received so much from society, this is definitely my opportunity to give back to society by bringing whatever the experience and expertise I have now as a student, not only as a student but also as a professional, having done one 10-week block placement to help others who may not be as privileged as I am to achieve their fullest potential in life. So by being in an interprofessional team, I will have to learn to work with people from different disciplinaries and acknowledge that they are the experts in their own field and not to intrude into their line of duty. Working in a team will help me to understand the importance of each profession, as well as the role that they play in providing healthcare for a particular client. So working with different professions will also give me a chance to learn practical clinical skills and implications, such as the way that they build rapport with a client, or the certain terms or jargons that I may not understand that I may need to know in the future, such as maybe from the speech point of view, things such as what is phonological awareness, or what exactly are swallowing difficulties, and then from a physio point of view, it could be what are the different kind of muscle diseases that you could have, or what are different muscles that are called. So this knowledge will actually help me as a clinician next time to further understand how can I as an OT better support them in achieving their goals, or as well as to know that what is within my scope of practice and when on to refer them to the speechies or the physios or even to any other professions. I have had experience working in an interprofessional team in my last 10-week block placement at the University of Queensland Life Skills Clinic. I was in the Speech and Occupational Therapy Clinic, which is what we call SPOT. And for every client that I saw, I work alongside with a speech partner to provide therapy. So by providing therapy that involves many different disciplines and or professionals, this allows us to provide a more holistic care for our clients, as every aspect of their lives being looked after. So in Timor-Leste, the culture of Catholicism is very strong, and it may actually highly influence their values and their outlook on healthcare. So it's important to know that the bulk of the population of Timor-Leste are Roman Catholics, so we need to take that into consideration when we provide therapy. And although literacy is still quite widespread, poetry is something that they enjoy and that they learn, as well as they value craftsmanship and weaving. So these are some things that we need to take into consideration when providing therapy. And in in Vietnam, much of the culture is governed by Confucian teaching. So this is because they were highly influenced by the Chinese in the terms of their thinking, in terms of their politics as well. So ancestral worship, respect for community and family values, handicrafts, manual labor, as well as a devotion study is something that's really highly embedded in their culture. So in both countries, as English is not their first language, learning how to greet appropriately or getting an understanding of what's culturally acceptable, what kind of language I should use when I first meet someone, what gestures should I use, how should my body language be, whether are females allowed to interact with males, or are we only allowed to interact with females. Is very crucial in building rapport with the client, so as to not cross those cultural boundaries. I am also someone who is a good communicator as well as a good listener whenever it is necessary. I'm able to mimic the way that other people communicate, especially when gestures and certain language and terms used may not be culturally appropriate. And I can do this through my tone and my speed, body language, facial expressions, and gestures to match theirs, as well as to match what's culturally appropriate. When communicating, it is also important that the environment is comfortable for everyone and that the noise level is kept to a level that's not so distracting. And whenever I talk, the use of jargon should be minimal. And if I were to use any jargon, that it'll be followed by an explanation after that. And I always check back if everything that I've said previously is understood and if they have any questions. It is also important to be a listener, so I need to give people time to speak and not interrupt. I'm also someone who is a professional and I'm able to conduct myself well in the public eye. And I understand that I'll be a representative of not only UQ but also the School of Health and Rehabilitation. So therefore, I need to be proud of this team, I need to own this team, and I will conduct myself in a culturally acceptable manner, remembering what is expected of me in terms of clinical expectations, what is culturally appropriate in terms of gestures, body language, and spoken language as well. So I am also a good team worker, able to negotiate and be flexible with my plans and my ideas whenever necessary. But on the other hand, I'm also not afraid to lead. I'm able to take the initiative / volunteer myself whenever help is needed. And I like to be positive, especially in times of stress and crisis, as I like to look on the bright side of things and show others that we can emerge out of this situation victorious. Thank you.